Hello, my name is Chander Mehta, and I am Professor Emeritus of Clinical Pharmacology and Toxicology. And today I'll be talking about COVID-19 infection. And as far as COVID-19 infection is concerned, the virus itself has been well publicized everywhere. In Wikipedia and so forth, you can see virus with the spike protein, and there are a number of views of that, and you can clearly see that the structure is kind of very unique. And when you take a cross section of it and see inside the virus, you can see that the virus has RNA as a genetic material, as you see here. And it also has various proteins like nucleocapsid protein. But most important is the spike protein. This is kind of a hook that attaches itself to the host cell, and by binding to the host cell, it can gain entry into the host. Now, host cell receptor that binds to this spike glycoprotein is ACE2 receptor, ACE2 receptor, and with that you can see a number of steps that are taking place and resulting in infection. So this binding site with a spike protein or a hook protein is really quite unique, and virus, if it does not have a very good spike protein, may not attach to the host cell and could be quite harmless. But unfortunately, COVID virus is really with a very powerful spike structure, and that attaches very easily to host cell and thereby becomes a source of danger. Now, the spike protein conformation has been very widely studied, and there are protein data banks of that, like 6VSB and so forth. Now, entry point for this virus takes place through the upper respiratory tract. So the virus enters while you are breathing, and once it enters, it usually gets into the upper respiratory tract first. Now, in case of Delta variant, they went deep into the lungs and caused severe lung damage, preventing any respiration or breathing in the lungs. And so patient died in the ICU on ventilators and so forth. Luckily for Omicron virus, which is also very widespread and has taken over Delta virus, Delta variant, you find that it primarily affects the upper respiratory tract system and doesn't go for some reason deep down. And so symptoms are usually milder and have milder outcome in a patient, especially if you are vaccinated, you have much better outcome associated with that. Once the virus gets into the host, attaches to the host cell with at S2 receptor, it can then gain entry into the host cell, open up, release its RNA genetic material, and start duplicating itself and producing large amount of viral particles. They are then assembled and released. Now, once they are released, I would like to show this in little more detail in a minute, but once it is released, the virus can be encountered by the immune cells like T helper cell. And as soon as they encounter that as a foreign material, B cells will be formed and they produce antibodies against the virus. And so those antibodies, they take about a week or more to produce, and they will block the viral body and thereby neutralize it. On the other hand, the T cells can also form what we call cytotoxic T cells or killer T cells. And once they are formed, they can directly attack the virus and kill it. So, this mechanism of entry and then what happens after the entry is really very interesting as far as what sort of immune response the host produces. And so, in that response, the memory B cells and the T cells that are sensitized or killer T cells, cytotoxic T cells, are important. Let me look at the entry point and so forth in a simpler diagram. So here is the attachment of the the virus to the ACE2 site. Virus gets into the host cell, opens up, releases the RNA genetic material, takes over the genetic machinery of the host cell, and start producing its copies. And it produces all different proteins and the genetic material that is in the viral body. And then these components are then, after replication, assembled in a Golgi body where the virus final assembly takes place and the fully formed virus then is released. And I already explained to you how T cells and B cells take care of it. And if there are not enough of those, then this virus can overpower the host and kill the host. So, one thing we need to understand is when to get medical attention. And medical attention is something that you should quickly go for when you have trouble breathing or you have persistent pain or pressure in the chest, perhaps indicating that the heart is involved, or you have confusion and disorientation symptoms, or inability to sleep or stay awake. All these are important symptoms that requires medical attention. I mean, medical attention. Now, blue colored skin or lips or nail bed, depending on the skin tone, can also be a very good indicator of seeking emergency medical help. This list is by no means comprehensive, so do consult your medical doctor and see if there are other symptoms that affect you and you need to take care of that. Now, when there is COVID infection, outcomes are something we have to look at. And as far as the outcomes are concerned, you find that 80% of the time there is recovery. But 20% of the patient will suffer severe symptoms of which some would recover and have either complete recovery or may have kind of symptoms hanging on or after effects, sequelae being persistent for a while. Now, the rest are suffering a very severe outcome, resulting in long-term hospitalization and death. And this group of patients are primarily having some risk factors. When the virus first was encountered and there was no vaccination, majority of the patients were older patients over 65, and they were really the main casualty of this infection. But as the vaccination was initiated in early last year, uh, this old age aspect was thankfully quite controlled, and other pre-existing conditions like that I will describe in a minute can be cause for concern. Now, pre-existing risk conditions that we are going to talk about are lung disease. Uh, Lung disease is involving a lot of conditions where lung itself affects the exchange of oxygen with carbon dioxide, and COVID does main damage by that pathway. So lung disease can be a very severe uh, factor for getting a very severe case of COVID-19. Heart disease, diabetes type 1 or 2, kidney disease, liver disease, cancer, HIV, mental condition, and pregnancy. All these have contributed to severe outcomes for after COVID infection. And so let's discuss them in a little more detail. Now, as far as the lung condition is concerned, you find that asthma is by itself a condition that can be moderate or severe, and asthma alone can kill you many times. So, combining with COVID, whether it is a moderate asthma or severe asthma, you have a very deadly combination. Bronchiectasis, which is really thickening of the lung airways, this particular condition where the architecture of the bronchioles is affected, can be quite dangerous. And also COPD, the chronic obstructive pulmonary disease, like emphysema and chronic bronchitis, can also be cause for concern. Now, there is also a condition called pulmonary fibrosis. This mostly, let me go back, this mostly is idiopathic, as we say in medical terminology, which means we don't know the cause of it, why lung scarring takes place, but it is, if it takes place and it's diagnosed, it can be quite dangerous. Many times, people who are working in a certain occupational area can have lung damage that causes fibrosis. But this definitely affects your oxygen exchange. Similarly, cystic fibrosis, which is a genetic disease, can also affect the outcome. Pulmonary blood clots, referred to as embolism, also can be very dangerous. Pulmonary hypertension, which by itself is a serious condition, can also produce poor outcome with COVID infection. And lastly, I like to discuss tuberculosis, which really is a bacterial infection where lung tissue is literally chewed out, and thereby breathing is compromised. You have to worry about COVID infection. And heart itself has also many conditions that can affect oxygen transfer, oxygen exchange, and that can cause problems. Heart failure is a good example. Coronary artery disease, cardiomyopathy, where you have enlargement of the heart and destruction of the heart tissue, can be a problem. Hypertension, stroke, and all these conditions somehow affect uh, COVID outcomes and can produce severe, really severe COVID outcomes. Now, other pre-existing condition can be diabetes and being overweight. And you can be overweight without diabetes, and that can also be dangerous. But diabetes, whether it's type 1 or type 2, is going to be a problem. Type 1 diabetes, which is childhood diabetes due to insulin deficiency, is definitely a risk factor. But adult onset diabetes type 2, which is due to decreased efficacy of insulin, can be a problem, particularly in overweight and obese people. Now, overweight and obese people are defined by their BMI factor, which is body mass index. And you find that in any internet website, if you Google BMI, you will see how to calculate your BMI. And you find that anything about 25, if you have about 25, say, but less than 30, you can have sort of a normal situation. But obesity is observed after 30 kilogram per square meters, and that can be dangerous. And of course, higher than that, let's say higher than 40, can be severe obesity, and it could be quite a problem. So get on some of these internet websites and find out what your BMI is, and that determines a risk factor for you. Now, there is also a possibility of weak immune system, and that if that is a pre-existing condition, then it can be dangerous. You find that some patients have genetic disease that causes lower immune response, and that condition can be as a result of uh, defective genes. Maybe a mother carries a particular gene for this immune response, and a male child gets it. Good example of this was, first example that was highly publicized was Houston bubble boy that had genetic condition where his mom carried the defective gene and passed over to him, and he survived for I believe 11, 12 years and then finally died in a bubble. But if you have any type of even a mild form of genetic immune defect and you get COVID infection, it can be quite deadly. Also, if you have HIV infection or immunodeficiency virus infection, that can also affect your immune system and you are at danger. Plus, there are many drugs that are producing what we call immunosuppressant effect. And these immunosuppressant drugs, such as corticosteroid, it is used mainly as a pain medicine in chronic arthritis and so forth. It can be something to worry about, so one has to be careful about that. Organ transplant drugs are anti rejection drugs, and they can also cause a problem associated with lower immune response, and that thereby can cause bad, severe uh, COVID 19 outcomes. And if these patients are not protected, let's say by vaccination, because of the poor immune reaction, you have to take other precautions to make sure, even if you are vaccinated, you have uh, compromised immune system, you have to be protected just like unvaccinated person. And you have to wear a good mask and follow doctor's orders and keep social distance and so forth. There is also increased risk of COVID fatality due to mental condition that is pre-existing. It could be dementia due to Alzheimer or any other cause. It could be a mood disorder of depression, bipolar condition, or you can have schizophrenia, and that can also cause bad COVID 19 outcomes. Now, pregnancy has been also cited as a contributing factor to hospitalization and so forth. So, pregnant females are generally seen in hospitals, many sad situations where mother delivers a baby that's perfectly healthy, but mother dies of COVID infection. And that's indeed definitely a very sad situation. There are also pre-existing blood disorders like sickle cell anemia or thalassemia, and they can also produce severe outcomes due to COVID-19. Substance abuse, drug abuse has been cited as also a cause for concern for COVID patients. If you are a smoker, whether current or former, you have damage to the lungs, and if it is significant damage, you are at a significant disadvantage with COVID infection. So, a current or former cigarette smoker should really be careful and protect himself with other uh, mechanisms such as wearing mask and so forth. Alcohol, opiate, marijuana, cocaine abuse can also get you into a situation where you can have severe outcomes due to COVID 19. Alcohol, in particular, I'll be talking about that in a minute in a little more detail. So you can see that substance abuse can be dangerous. Now, kidney disease, if it's pre existing chronic kidney disease, damages the kidney and thereby affects the kidney function. Blood is not cleaned properly, so the toxic bio-waste products are accumulated in the body. There is edema or extra fluid in the body. All that can result in high blood pressure, heart disease, stroke, and early death associated with COVID infection. Liver disease is a condition where there are either fatty liver or cirrhosis of the liver. Hepatitis, one has to be careful about that. Now, hepatitis can be caused by viruses and also chemicals, so one needs to seek medical attention if you have liver disease superimposed with that COVID 19. I did mention alcohol and drug abuse. And this is a special case because alcohol per se in itself is a hepatotoxic or liver toxic product, because alcohol breaks down into a product that is toxic to the liver. So, long lasting abuse of alcohol in alcoholics can cause scar tissue, which we call cirrhosis of the liver. It starts out as fatty liver, and gradually, as it progresses, you can develop cirrhosis of the liver, and that is irreversible condition. And in cirrhosis patients, COVID infection can be deadly. So anytime a patient sees jaundice or yellowing of the skin, it can be a sign of liver disease, and one has to seek medical attention. And finally, the people that are mostly at risk are the unvaccinated people of any age. So if you are unvaccinated, you will be most likely to be hospitalized and face death. Even in this Omicron situation, where cases of Omicron that cause hospitalization, usually majority of them are unvaccinated people that have gotten Omicron. Others with vaccinated people with Omicron have infection, but it's mild and they recover very well. So, getting vaccinated is a very important, effective preventing tool for uh, saving yourself from COVID infection. And when you interact with anybody who is unvaccinated, you got to protect yourself, because in this day and age of Omicron infection, even the vaccinated people get infection, though the outcomes are mild. It is better to watch out dealing with unvaccinated people. With this, I'm ending my presentation here. If you have any questions, please do write to me about them. I'll be more than happy to answer them. And I hope you understood this lecture. If there is need for any special presentation that you would like to hear from me, I'll be more than happy to do it for you. Thank you very much, and goodbye.